Queer Up Health. New clinic by and for transgender people seeks to revolutionize healthcare. The 2015 U.S. Transgender Survey by the National Center for Transgender Equality reported that just 40% of transgender people were out to all their healthcare providers. Many providers have also historically struggled to provide the fully comprehensive transgender care. Patients report being misgendered and feeling situations where their providers may not embrace who they are. They don't understand their specific needs. Transgender people have tried to get advice on hormones, surgery expectations, aftercare. They need to look to other organizations and things like YouTube, Instagram, and TikTok because providers aren't versed in their medical needs. Since opening its doors in May, Trans Health Northampton has served more than 330 patients throughout New England. The health is focused on reaching patients in the most remote stretches there, where trans-affirming care wasn't previously offered. Trans Health offers a full spectrum of primary and mental health care, checkups, surgery consults, counseling, psychiatry, and even a community center with workshops. The space is the brainchild of trans man Perry Cohen, founder of queer wilderness organization Venture Out, and a longtime LGBTQ+ philanthropist.
You know what got me from this story was just that only 40% of trans folks are out to their healthcare providers. That broke my heart.
Well, also surprising that how good is their exam if their healthcare provider doesn't know that they're trans. Yeah. I mean, if you're doing a full physical and you get your annual, they should be able to know that.
Also ask makes you wonder how much healthcare access they're even trying to get.
Right.
Well, even here in South Florida, some of my chosen family works in healthcare. And they, as part of the community, know about transgender healthcare because they've researched it. A lot of the people they've worked with, doctors and whatnot in the community, don't understand the nuances of the hormones and what they can do to your body as you're transitioning. And so they really need specialists. And even here in South Florida, there's a lot of that lacking. As big as our LGBT community is down here.
You know, and that's the thing that strikes me the most. I think you really hit the big soundbite of this story. Congratulations to this doctor that has created this clinic, and please reach out to South Florida and help us organize something similar, because it's something that is definitely needed here in South Florida. We have among the largest trans communities in America, and we don't have anything like this here.
We did a piece at the restaurant with SunServe where they brought in a lot of local transgenders, but a lot of them don't live in Wilton Manors because they can't afford to live east. They live west of 95, and they're pretty much shut in, and they don't seek the medical care because they don't have the financial means or the resources to do it. And it is very sad to see that, because they can't be their true self in so many ways because of limitations economically and from health services.
Good health care is a right.
It is. No, it's a right, yeah. But let's not forget that in South Florida, we do have some amazing organizations that help our trans community. You know, Ariana Center, we have Trans Social, and they do a SunServe. They do incredible for our trans community. But it's not enough. We need more, a lot more.
Great first step here, though.
Yes.
LGBTQ+ news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBT